Well, it looks like the room is filled, which is great. We have a good turnout this evening. I'd like to welcome everybody this evening. I'm Kevin Edwards from Allied Physicians Group. Congratulations on your newborn, and thank you for joining our Baby Basics webinar. Tonight, we will focus on everything you need to know about your newborn. Our hope is to provide you with valuable answers to many of the questions you are facing. A few housekeeping details before I hand it off. If you have additional questions, you'll notice there's a Q&A feature on the bottom of your screen. Please feel free to type in there, and we'll address those at the end during our Q&A session. And then also following this webinar, we'll be sending out a link to this webinar, as well as other useful resources. And one of those resources will be newborns and COVID-19. It's a webinar we did a couple of weeks ago that we think will be very beneficial. So we're going to send that link as well. You'll see that tomorrow once we get this webinar downloaded and all put together. And with that, I thank you again for joining us. I'd like to introduce Dr. Kerry Fierstein from Allied Physicians Group, who will be leading our discussion this evening. I don't hear you, Dr. Fierstein.
Can you hear me now?
I hear you now. There we go.
Excellent. Thank you, Kevin. I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, a practicing pediatrician for 30 years in Plainview, a mother of 3, and very recently a grandmother of 1. My grandson was born 7 weeks ago, so I've gotten to see firsthand all the new parent questions and things that come up. New parents want to do the right thing, but they don't know what the right thing is all the time. So you guys have taken an excellent first step, or an excellent step, maybe not your first one, in joining us here tonight. Not only because you're going to learn some really great stuff, but more importantly, because you've picked a trusted resource. As a parent, you're going to have to make decisions every day, many, many decisions. And you can't fully research all of them. There's so much information on the internet. It's really important that you have people that you trust and bodies that you trust in order to get your information. Allied Physicians Group is one of those wonderful sources of information for you. Your pediatrician, of course, will also be an amazing resource. Later in the program, Dr. Levene is going to talk to you about how to choose a pediatrician. But I'm going to talk to you a moment about why Allied Physicians Group is such a trusted resource for you. The best thing about Allied Physicians is that we are pediatrician owned. So every practice that you go to has a pediatric owner who's helping to make the decisions. We're not part of a hospital. We're not part of a multi-specialty group. Children have their own needs, and it's very important that when you design a practice, when you design your workflows, that it's all with the children in mind, and that's what you get with Allied Physicians Group. Each one of our offices, we have 34 offices across Suffolk, Nassau, Queens, Westchester, Rockland, Brooklyn, Staten Island. Each one of our offices is physician owned, and you'll always, we're level 3 medical homes. So each one of our offices has hit certain markers that we need to do to prove to the governments and the bodies that be that we are indeed patient-centric. Each one of our offices has to meet quality measures when they come in, and we have to meet ongoing quality measures as well. So the great thing about Allied Physicians Group is that we have so many pediatricians who are always learning and investigating and sharing that information with everybody, and then the doctors get to share that information with the patients. So you're going to learn a lot of information tonight from some great allied physicians. They may or may not be the ones that live in your area, so you may decide to choose a different allied group. Either way, you know you're going to be getting the allied quality. So tonight we're going to do very little COVID. We can't ignore it completely because it is permeating everything that we do, but mostly we're going to just talk about having a healthy newborn. And I want to introduce the people who are going to be talking to you tonight, because it's always nice to put a face to the name. So let's start with Dr. Levene.
Hi, I'm Dr. Eric Levene, and I'm in Westchester, New York at Chester Pediatrics. I've been a pediatrician for 25 years, a father of 2 older kids, and 1 child who seems to help us out a lot on with COVID. She's getting her PhD in viruses and has helped us a lot.
Yes, we love Rachel. She's the official virologist of Allied Physicians Group. Dr. Visentin.
Hi, I'm Dr. Lisa Visentin. I work at Peconic Pediatrics in Riverhead. I am a pediatrician and a IBCLC, which is a international board certified lactation consultant. So I'll be talking to you guys a little bit about feeding and breastfeeding today.
Okay. Dr. Chalson.
Hi, everyone. I'm Dr. Maggie Chalson. I am a practicing pediatrician in Plainview, and I've been practicing for 15 years, which is a crazy number to say. And I am the parent of a crazy, fun 11-year-old who has taught me as much as I've learned working in a pediatric office.
Yes. And for full disclosure, Dr. Maggie and I work together. So Kevin, do you want to start the slide deck?
Absolutely, here it comes. All right.
Next slide. Next slide, please. There you go. Okay, Dr. Visentin, it's all yours.
All right, thank you. So I'm going to be starting talking about feeding. This is one of the more common questions that new parents have, one of the first sort of big things that everybody is talking about. And before I begin, I want to stress that at Allied, our goal is to support both mom and baby, to help them achieve their goals, whatever those may be. And so you will hear a lot of different things from different pediatricians, and you'll hear a lot of different advice from people about breastfeeding versus formula. And just to remind everybody that our goal is really to support mom and baby in whatever their particular goals are, and to help them achieve a healthy relationship. So I'm going to start off by talking a little bit about the benefits of breastfeeding for moms and babies. As a pediatrician and a lactation consultant, and I forgot to say in my intro, I was a little nervous. I have 2 kids of my own. Everybody else mentioned that, this is my first webinar, so I forgot to mention that in my intro. So I'm going to briefly go over the benefits for moms and babies. I could talk about breastfeeding for probably a whole webinar in and of itself, but I will try to keep this short. Babies who are breastfed have decreased risk of diarrhea, of upper respiratory infections, otherwise known as colds, ear infections. Breastfeeding is a easily absorbed source of nutrition. So moms produce exactly what their babies need. Breast milk contains antibodies from moms, which is helpful in protecting them from getting infections, especially in this time of COVID that we will talk about a little bit later, that it is encouraged for moms to continue to breastfeed if that is their choice, and it will provide antibodies for them to help protect them. Breastfeeding can also help the baby control how much they're eating, as opposed to a bottle where the parent who's feeding them is a little bit more in control. There are also lots of benefits to breastfeeding for moms. Breastfeeding early after delivery can help the uterus contract. It helps moms lose the pregnancy weight after delivery. It also decreases mothers' risk of breast and ovarian cancer. Moms who breastfeed have a decreased risk of diabetes and hypertension. So there are many, many other benefits to both mom and baby for breastfeeding. Those are just a few. Some of the other things to consider when you're choosing how to feed your baby is what mom's feelings are about that and what their support are. And that's something that you should talk through with your partner prior to the delivery about sort of what your goals are, realizing that babies sometimes have their own plans, but it's a good idea to think about through initially what would be in your ideal situation, how you would feed your baby. In order to get breastfeeding off to a good start, we encourage you to start early and often. So in the hospital, assuming that mom and baby are healthy and there is no medical contraindications to breastfeeding, the best thing to do is to start breastfeeding within the first hour after delivery. And your baby's gonna feed pretty often. An average newborn typically feeds 8 to 12 times in 24 hours. So that's about every 2 to 3 hours. And that's whether they're breastfed or bottle fed with formula, that they're going to be eating pretty frequently. Another important thing to remember is to ask for help if you need it. When you're in the hospital, most hospitals do have lactation consultants. A lot of the nurses will be able to help you with positioning. You can do a lot of reading. You can come to these websites and these webinars, but until you have your baby in your hands, it's a different experience. And oftentimes you do need some additional help to show you how to place that baby on your chest, how to get a good latch. And so don't be shy about asking questions and getting that help early on. Once you're discharged from the hospital, Allied has a variety of resources if you need it. We have multiple doctors, 3 within Allied, who are both pediatricians and IBCLC, so lactation consultants. We also have other additional lactation consultants who work in different offices throughout Allied. And we also have a hotline that's answered by our lactation consultants. So if there are other questions that you have once you're discharged from the hospital, there are a variety of resources through Allied that you can reach out to get the support that you need. Dr. Levene is going to talk later about COVID. I'm going to briefly talk about it in relation to breastfeeding. Having a COVID infection, if the mom were to be infected, that is not a contraindication to breastfeeding. It is recommended that the mom wear a mask because you are worried more about that direct contact. But so far, COVID has not been transmitted through breast milk, and it is still recommended for moms to continue to breastfeed. Another option would be for a mom to express her milk and have a healthy caregiver feed the baby milk. Express breast milk, excuse me, if mom was not feeling up to actually breastfeeding. When we get to the COVID section, if there are other questions specific about breastfeeding, I can always answer, those. Next slide, please. So I'm going to transition to talking a little bit about sleep and SIDS. SIDS stands for Sudden Infant Death Syndrome. Lots of parents have questions about sleep and what's a safe environment for sleep. Babies should always sleep on their back. They should sleep on a flat, firm surface. That decreases their risk of SIDS. There shouldn't be anything else in the crib with them. So this is a very good example, this photo. Lots of people think that it looks kind of bare and they're worried about the baby, but we know that this is the safest way for your baby to sleep. An average newborn sleeps a lot. They sleep 8 to 16 hours in a day. However, that's very broken up. And so parents are going to be sleep deprived and not really feel like their baby is sleeping a whole lot. And it's going to be in very small chunks, but we do want to make sure that when the baby is sleeping, that they are safe and that they are on their, back. Next slide, please. Another common question is swaddling. Swaddling can help calm babies. It can help them sleep longer. In the hospital, a lot of the nurses will be able to actually hands-on show you how to swaddle. And then if you still have questions when you come into your pediatrician, they can also show you how to do that. There are also other videos online that you can watch in order to how to swaddle your baby. This picture is a good example of what they kind of look like when they're all nice and wrapped up, helps mimic how they felt when they were in the womb. You do want to make sure that you snugly wrap your baby, but not too tight. You should be able to place 2 fingers in between your baby's chest and the blanket, and that's how you'll know that it's not too tight. If it's too loose, the baby's going to be able to wiggle out of it, and it's not going to provide them that sort of calm, secure feeling and help them be able to sleep. The blanket should be that kind of snug around their chest and then looser around the hips. You want them to be able to freely move their legs. There are lots of different ways to help calm a baby. The babies are used to being held all of the time. And so they are not used to just being put down after they are born, and swaddling can really help that transition and help calm them and help them sleep longer. Next slide, please.
Dr. Maggie, this is for you.
Hi, everyone. Can you see me?
No. Oh, yeah.
Yes? Okay.
Yes, you
Yes.
can. Yeah. So the speakers, just so you know, you are on camera when you're talking.
So I have the pleasure of talking to all of you about things that you're going to think about and worry about once you get the baby home from the hospital. There are so many things that will come up, and we encourage you, all of us, to keep a list of things that might come up that to you might really seem mundane or like a silly question to ask. But as parents and pediatricians, we want you to ask these things so you feel like you are really giving appropriate care to your child and having all of your questions asked in a timely manner. We have heard everything, so I promise you nothing you guys come up with will ever feel stupid to any of us. So first thing we're going to talk about this evening is grooming. And a lot of these are really fun experiences, maybe not the diaper changing part, but certainly bathing and taking care of the baby's skin and all of that is just a lovely bonding experience that you all will have. So let's start with some baby basics. Diapers are obviously something that you are going to know a lot about from the moment the baby arrives, because babies are healthy if they're peeing and pooping and eating and sleeping, and that is pretty much what they do from the very beginning. So babies come from the womb with the most perfect skin that you will ever see, and we work our entire lives to get back to that. And it's very important to realize that it is sensitive and needs extra special care. So in terms of diapering the baby, whether you use a packaged diaper or a cloth diaper is certainly up to you, but making sure that you're taking good care of the baby's skin by frequent changes, and certainly using the appropriate lotions and creams is very important. It's often recommended in the hospital to use Vaseline every single diaper change, and if you think the baby looks irritated, that's certainly a good idea. But if the baby's skin looks wonderful, there's probably no need to put anything on it after you clean it nicely after a dirty or a wet diaper is changed. You may notice within the first few days that especially around the baby's bottom, there can be some skin breakdown. And again, this is from living in a nice water environment where their skin is totally protected to now being in this environment where we're putting them basically in a plastic diaper land. And if you do notice that, then the Vaseline is definitely warranted. And that's the time, if you see skin breakdown, where you might want to use some kinds of white zinc type of product like a Visentin or Balmex, or even a triple paste or butt cream. A lot of people use Dr. Boudreaux's. Whatever you're comfortable with is fine, as long as it's gentle and for sensitive skin with little fragrance or any other additives. The other thing that's very important, especially for little girls, is wiping from top to bottom. You don't want to bring the stool up to the front. You don't want to introduce any areas of infection. Obviously, this matters less for little boys, especially before they're circumcised, but is something to consider after circumcision as well. I know that circumcision is sort of lower down on this list, so I thought I would include it now with our diaper conversation just because it makes the most sense in terms of care of the diaper area. Circumcision is a personal choice. People often make the decision based on religious reasons, or they make the decision because they want baby to look like daddy, but the choice is really yours. In terms of health and cleanliness, it is definitely recommended to make sure that whether the baby is circumcised or not, there is really good skin care around the penis, and care of the circumcision after it is done will certainly be demonstrated if it happens in the hospital by the nursing staff in the hospital, and if it happens in a religious ceremony like a bris, usually by the mohel. It has definitely shown to decrease the spread of infection of certain kinds, especially HIV, if circumcision is performed. However, again, this is really a personal choice. The circumcision care, the most important thing is put a lot of lubrication on the healing area as well as in the diaper so nothing is sticking together. And again, that will be gone over numerous times with all of you. The next topic on the list is nail care. It is shocking to new parents how quickly those little nails grow. And you may even be surprised to see that when the baby is born, especially if they're born a little bit after their due date, that those nails look like they need a manicure right away. Sometimes they can even be growing right over those little fingers. And people are often very concerned about how to take care of those nails because they're so delicate and fragile, and people are afraid of clipping the baby or nipping the baby. So certainly in the beginning, if you're feeling anxious about that, using a nail file is a great way to start, and it will decrease your anxiety about using anything that could cut the baby. But you may have to file those nails every single day because they really do grow that quickly. A lot of parents are very anxious about using a clipper because you'll find when you use a baby nail clipper that you're not able to really visualize the whole nail. The clipper kind of gets in the way. So some people find that using a little cuticle scissor gives them a little bit better control and you can see what you're doing a little bit better. But I think the most important take-home message is to keep those nails nice and smooth, because those little hands that are not so controlled can flail all about, and then the baby can end up with little scratches on their face, which we certainly don't want. Some people do like to keep the little mittens on the hands. Some of them are attached to onesies, some of them are separate. But if your baby is looking all the time for their fingers because they were a little thumb sucker in the womb, having those mittens on might really make the baby unhappy. So you'll have to see when you meet him or her. Umbilical cord care is really pretty simple. All you need to do is keep that little cord clean and dry. There is no indication for use of any water or soap or alcohol rub or anything else. Is to just keep it dry, which in certain cases means you may want to fold the diaper down to keep the top of the diaper away from the umbilical cord. But if the baby is really teeny, sometimes you find that you need to keep the diaper up high above that umbilical cord. Things you might want to alert your doctor to is if the cord starts to have a funny odor, or the baby seems uncomfortable when you're touching it, or there's any redness surrounding that little area. Those are things that the doctor would want to know about and maybe see in the office or via a telemedicine visit, which we can certainly do at Allied. Skincare, like we talked about earlier, is a really nice part of the baby's routine. The baby's skin is lovely and perfect and peaches and cream and just feels so nice to snuggle and touch, and the baby will really enjoy when this part of the routine is occurring. It is generally recommended to use something that is very gentle and sensitive. It doesn't necessarily need to say baby on it, but it should be unscented, gentle, lotions. You can even use something like an olive oil or an unscented other oil like a jojoba oil to do some baby massage and keep them nice and moisturized. But again, because their skin is so perfect when they arrive, sometimes little care is needed at all. And the last thing about general grooming is burping, and that sort of fits into the feeding category a little bit, but it's more about how we're caring for the baby all the time. Babies have different abilities to burp. Some are really good at it and some not so much at all. Those who are breastfed, because there's not a lot of air in the system, sometimes are not very good burpers at all. And you sit there trying between breaths to get that burp out and nothing is coming, and it's just because there's no air sitting in there. But bottle-fed babies, you're going to want to pace those kiddos. And, you know, in the beginning, when they're taking small volumes, like 1 or 2 ounces, every half an ounce to an ounce, you're going to want to take that bottle out and make sure you're burping the baby really nicely. It's very important because the air that gets trapped inside the esophagus can act like a little elevator. And if the formula or breast milk is sitting on top of it, then that air can come right up, and then that's when we have lots of spit up happening. So burping is something that you'll sort of figure out as you go once you figure out exactly how you're going to feed the baby. Next slide, please. Should I worry? Well, welcome to parenthood. You will always be worried. But there are certain things that you really need to worry about. And probably the only thing on this list that you really need to be concerned about is temperature or fever. So fever in an infant of any age is anything more than 100.4 rectally. And the way we take a proper temperature in a child that is teeny weeny is in the rectum. This means we take a thermometer, we put some lubricant on it, we keep the diaper underneath so as not to disturb any of your nice sheets or couch or carpet, because for sure as soon as you put something in that little tushy, there will be an accident of some variety. And you leave the thermometer in until it beeps, and hopefully you will see a number that is less than 100.4. But that is the number that is the magic number. If that number ever happens, it does not matter to a pediatrician if it is 1 o'clock in the morning, 1 o'clock in the afternoon, tea time, shower time, you pick up the phone and call, and we will advise you what to do next. The rest of the things on this list are things that you will notice about your children, but really nothing to be concerned about. So hiccups and sneezing are both normal baby reflexes. Hiccups happen because there is a nerve in the back of the throat that is just on overdrive in little people and can get hyperstimulated and cause them to hiccup. It's not dangerous to them, it's not uncomfortable to them, it's pretty cute sometimes, but it is nothing to be concerned about. And sneezing is a similar reflex, but you know, a baby doesn't have enough dexterity to pick their own little nose or to blow their own little nose. Heck, my 11-year-old can't even really blow his nose well. So sneezing is a way that the baby clears something out of his nose or her nose that's bothering them. So if you find that the baby is sneezing a lot and you see that there's any nasal congestion, you may want to use a bulb suction or a little bit of nasal saline drops to try and see if you can clear the baby's nose for them. Periodic breathing of the newborn is something that comes up a lot and is reason to have cause for concern for parents, although it is nothing to worry about. And what it looks like is that the baby does these little shallow panting breaths and then takes this big giant breath and then totally pauses and there's nothing for a few seconds. And that's the part that freaks people out. But it is a total normal breathing pattern for a newborn baby and absolutely nothing to be concerned about. Anytime you have any respiratory issue with your child or anything related to breathing, even if you have just heard me say that this is totally normal, it's still probably something that should be discussed with your pediatrician. And the last thing about worry that comes up pretty frequently in the newborn period is crossing eyes. And you can actually try this yourself, but I brought a pencil here with me. And if I follow this pencil carefully enough all the way in, I am now crossing my eyes. So a newborn who has lovely vision at close distance, like when you're nursing a baby, is still trying to focus and find you. And that may mean that those eyes come together sometimes. And that's a totally normal thing in the newborn period and absolutely nothing to be concerned about. Now, that being said, there are other things with eyes that are certainly concerning. So if you see only one eye doing that all of the time, or you see that both eyes are moving side to side all of the time, or anything else looks unusual, that is definitely something, again, to discuss with the pediatrician. But it's just that crossing sometimes, especially when something gets very close to the baby, it's absolutely nothing to worry about. Next slide, please. Visits and vaccines. So every office that you go to, no matter where you choose, will have a little bit different office visit policy and vaccine schedule. So let's just talk about some general expectations that you might expect when you leave the hospital to keep your baby healthy and safe. So in the first few weeks or months, we are going to get to see the baby a lot, which is lovely for a whole lot of reasons, mostly because babies are the most delicious and we love to snuggle them and help you through a difficult adjustment process in your life, but also because it gives you the opportunity to ask a lot of questions that come up while you're at home. In our own office and most offices Allied-wide, within the first week, once you're home from the hospital, we will want to see the baby in the office. Right now, because of COVID, some of those very first visits, once you're straight home from the hospital, will happen via telemedicine. And this is to make sure that we see the baby because you're going home from the hospital in a little bit quicker time period than you otherwise might. And then typically within that week, we'll see the baby in the office. The first visit in the office is basically a place where we can weigh and measure the baby and get an accurate height and weight to use as a starting point. Examine the baby and make sure that everything looks and feels a-okay, and spends a lot of time answering these questions, some of which we may address today, but others you'll find come up as you're home and things arise with your child. And then after that, typically for the first couple of months, we see the baby every month or every other month to do much the same. Most children that are vaccinated with their first vaccination in the hospital, which is the hepatitis B vaccine, don't require another vaccination until they're 2 months of age, which makes those in-between visits very nice, both for baby and mommy or daddy. Nobody has to worry that the baby's gonna get shots or have discomfort or cause discomfort for parents who are worried in any way, shape, or form about vaccinating. It's just a nice time for you to meet your pediatrician and let us get to know your families. So it is very important that you get that first vaccination in the hospital, both because its efficacy is proven when we give it then, but also because you'll have all these nice visits in the interim with less worry. It's also really important that parents or any caregivers that are going to be around the baby after return home from the hospital have had their Tdap vaccine. That's the whooping cough booster shot, and also the flu vaccine when it's in season, because the baby is too little to have either of these things, and both flu and whooping cough can be really dangerous to newborns. In terms of vaccine safety and efficacy, I think all of us across Allied and pediatricians in general can agree that the vaccine supply in the United States is safe and effective, and we vaccinate based on the American Academy of Pediatrics and the ACIP vaccine schedule. Some offices separate some of these vaccines a little bit, either by giving some vaccines 1 month and one more vaccine the next month, instead of waiting from 2 to 4 months, while others will give all of those vaccinations at 2 months and 4 months and 6 months. But either way, we all believe that the vaccine supply is safe. We vaccinate our children and care for them the same way we hope to care for yours. And as questions arise or special concerns or dispensations need to be made, those are all things that you can discuss directly with your pediatrician prior to getting those vaccinations. You should always feel that you can ask these kind of questions, know what to expect after you get the shot, know exactly what we're protecting your children from. Especially in this time of COVID, is so important to make sure that we prevent these childhood illnesses that have been really dangerous and deadly in the past, and not forget that these routine vaccinations are tremendously important. And with that, I think we're heading to Dr. Levene for the next portion of our meeting together.
Thank you. So how to choose your pediatrician. It's it's one of the questions parents always ask: who's going to take care of my kids? Well, the first thing you have to think about, as in when you look for a house or an apartment, is the location. Where is the pediatrician? How am I getting to the pediatrician? Do I have a car to drive? Is there public transportation? Those are the most important thing. Picking a pediatrician who is an hour away from your home is not really going to work very well, especially if your child is sick and you need to get to see the pediatrician. So after you've sort of chosen a general area of looking for a pediatrician, how do you find out? Well, if this is going to be your first child, you're going to ask friends who have children who are local. Who are their pediatricians? You're going to go online, which I'll talk about in a minute, which has positives and negatives. My recommendation is, if you're new to an area, is call the local hospital, call the nursery, ask the nurses in the nursery, what pediatricians do they use? They know who the doctors are usually. That's one way to sort of get a bunch of names. If you're looking at daycare providers as well, ask the daycare who they work with. That's always important because they know some of the doctors as well. Going online, people will go and look at reviews. Remember, reviews many times are given by people who haven't even been to that pediatrician. People give reviews that are positive and negative. Sometimes the person giving the review doesn't have the same thing that you're looking for in a doctor. So that patient-doctor relationship may not have worked for them, but could possibly work for you. So when you're reading those online reviews, just like you do when you're picking a restaurant, and hopefully we'll all get back to a restaurant, you're going to take it with a grain of salt. So once you've made a choice of, oh, let me have a few pediatricians, it's time to get an interview. Before COVID, most of us at Allied would do an in-office interview. You come in, see the office, talk to the pediatrician. Right now, most of us are doing by phone or actually virtual visits for expected parents. And we tell you what our practices are like. I always tell people, make a list of questions. Number of providers in the office. What are the office hours like? What are the after hours like? What's the on-call like? What are the weekends like? How do I reach a pediatrician after hours? Can I talk to a pediatrician during the day? What are the well hours? What are the sick hours? What are your usual wait times? These are the questions we all ask. Right now, of course, most of us at Allied are doing a lot of virtual telehealth for our sick patients and doing a lot of in-office well visits. Hopefully that we won't be giving up telehealth, which I think has a really great place, but a lot of it, we want to see our patients back in the office. Communication, how do I communicate with the doctor? How do I communicate with the office? Those are the things that you want to know. Is it phone calls? Is it email? What works for you? What works for your friends may not work for you, but you got to see how it works with that pediatrician. The one thing about groups is ask them, do I have to see the same doctor all the time? Or what happens if my primary doctor is out? How does that work? The other thing that I think is important to ask is, how does the doctor refer to specialists? At some point, for some reason, whether minor or major, your child's probably going to see a specialist or an orthopedist or somebody. How do they refer? The great thing about Allied is we are not beholden to any hospital system. So we are going to choose a specialist or recommend a specialist that we think best suits your child and your child's needs. So those are a lot of the important things in choosing your pediatrician. Next slide. COVID-19 and newborns. COVID is on our minds constantly, as if having a newborn is not stressful enough, but having a newborn in COVID and a pandemic makes it certainly much worse. If you're still pregnant and worried about delivering, call the hospital that you're planning on delivering at. Learn what their policies and procedures are. How long are partners allowed to stay? Is everybody being tested? At our local hospital, both the mother and the partner are tested with a quick test. If the partner is positive, the partner is kicked out of the hospital. But that's my local hospital. Other local hospitals have their own rules. Talk to your OB or midwife. What's the policies on COVID positive mothers? What are the policies on the baby being COVID positive mother having the baby in the room? Dr. Visentin has discussed about breastfeeding and COVID positive mothers. Lots of different rules, lots of different ways of doing things. Certainly it all has to do with the health of the mother. But I think the important thing is visitors. People, how am I going to allow people in my home? My personal feeling, and I think a lot of our pediatricians are, is unless we know that that person is COVID negative, that we're not going to let them near the newborn. I'm certain that grandparents are desperate to see the newborn, and I think Dr. Fierstein can attest to this, that you may want the grandparents to self-isolate 14 days before your due date, so they're there to help you. They can self-isolate and then be there at home when you get there to help you with the newborn. But if there's nobody who can possibly do that, keeping in contact with grandparents, relatives, and friends, virtually or social distance, it's very important both for mental health and just helping out. Have people help you. Have them deliver food. Have them help in any way they can to help you out like they would if they could come and visit. The pediatricians usually tell parents to keep sick people away from the newborns. And I think that's just a similar policy. That doesn't mean you can't get out. Go out, take a walk, put your mask on, cover the carriage, get out and walk. Just stay away from others. It's important for your good mental health. Next slide.
Great. Can you guys hear me?
Yeah.
Okay. So we spent a lot of time talking about the baby, and we just wanted to spend a couple of minutes talking about self-care, mainly for moms, but also for their partners. That yes, you're having a newborn and the focus is going to be a huge focus on the baby, but also to not forget, to take care of yourself. Just like the saying, when you're on an airplane, you got to put your own mask on first. If you as the parent are not taking care of your own self, both physically and mentally, then you won't be able to take care of your newborn. So making time to make sure that you're eating something, that you are taking a shower. As Dr. Levene said, that you're making some time to go outside and get some fresh air, something that sort of helps you. New parents are going to be sleep deprived, and that is a very difficult thing. It makes everything harder. When you haven't gotten enough sleep, things that used to not bother you will really bother you. And it's important to recognize that and know that and do as best you can within having a newborn, things to sort of mitigate that. And so don't feel like you can't express those things. Talk to your partner, talk to your friends, your family members. Those are normal feelings. For the moms, recognizing that you just had a baby. That is a big deal. I think society, a lot of things on media, you see these moms the next day, they look all perfect and they're going about their life like nothing ever happened. And that's really not reality for 99% of people. Some moms medically, they have a tough time. There may be complications that they don't realize. Even if your delivery goes, exactly according to plan, there are no complications. You had a baby, and that is a huge change in your body hormonally, physically, emotionally. You may feel emotions after the delivery that you didn't expect. Postpartum depression and baby blues can happen, and especially in people who had some anxiety and depression prior to pregnancy and delivery. Right now, with everything that's going on with COVID, everybody's feeling a little extra anxious. And so then you add a newborn into that, and there may be increased risk of parents feeling anxious. And so just sort of being aware of that, knowing that after the delivery, you do have a lot of hormonal changes that can lead to different feelings, that you may be feeling happy or sad in ways that you didn't really expect. And those are all normal things. And I encourage you to reach out to your family, to your friends, and to your pediatrician. They will, at different visits, ask you how things are going. You will probably also get some questionnaires at some of your visits to sort of check in the newborn period, and then as your baby grows, to make sure that your mental health, to see how you're doing, because it's important to take care of yourself. Some other sort of logistical things, it might be a good idea to kind of have an idea where you're going to feed your baby. Have your cell phone charger nearby, have a water bottle, have some snacks. Whether you're going to be breastfeeding or bottle feeding the baby, you're going to be spending a lot of time feeding. And having all of those things sort of within easy reach for you will make it a little bit easier. Visitors, as Dr. Levene mentioned, it's going to be a little bit different in times of COVID. Before, we would, encourage you to have, accept help when it's offered. And that's going to be a little bit different now, but definitely if there are family members that you feel comfortable having over with everything that's related to COVID, allow that help. You don't have to do everything, especially if you have a partner who's living with you. Allow them to help you where you can, and give yourself a little bit of grace that you just went through a major transition, both physically and emotionally, and you need to make sure that you're taking care of yourself so that you can be the best parent to your baby. Next slide, please.
I think this brings us back to Dr. Levene.
Yeah. So at Allied, we are truly here for you. We are totally pediatric centered. We're here for your children. We're here for your families. As Dr. Fierstein has said at the beginning, all our offices are level 3 medical homes. By medical home, yes, there's this official medical home designation, but you really have to think of your pediatric office and your allied pediatricians as your medical home. We're here. You can call us, email us. We're here to help you with whatever decisions you may need. Whatever questions you may have. From breastfeeding, as Dr. Visentin has talked to you about, we have a breastfeeding division. We have our in-office visits, we have telephone, we have telehealth, and our Anytime Pediatrics platform telehealth. All of our divisions are doing telehealth every day. The great other thing is we have evening telehealth. Allied has an evening telehealth pediatrician. She's there from 6:30 to 10:30 p.m. every day. And it may not be your pediatrician, but it is a pediatrician who is looking at your chart and has all the information that we have put in there. So they know best, better than your insurance telehealth, better than PM Pediatrics telehealth. Speaking of PM Pediatrics and urgent care, call your pediatrician first. We may be able to tell you how not to get to the urgent care. We also may refer you to the best urgent cares that we know, or you know what, that really needs an emergency room, or you need to go to this kind of emergency room or that kind of emergency room. We're here to direct not you just to our offices, but to direct you to the best care that we think for you and your child. We know your histories. You may go to an urgent care, they will treat your child, but I'm going to look at what they tell me and say, you know what about your grandma who lives with you who's immunocompromised? Have they thought about that? Have you thought about that? We're your home. We're your medical home. That's what Allied is about.
Thank you, Dr. Levene.
Great. So I'm just going to jump in here real quick because we have a newborn exam video that Dr. Fierstein has created, and we're going to run that right now.
So you've probably figured out that newborns are not like little adults. I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, and now grandmother of 1. Let's go over a newborn exam today. Very alert. So just looking at a baby, a healthy baby tends to be flexed. Sometimes when they're first born, their color is a little bit yellow. That's normal. All babies are a little bit jaundiced. If you're concerned at all, you should talk to your pediatrician about that. Jaundice tends to start from the head and go down. So a little bit on the face and on the chest is normal, but again, review that with your pediatrician. When new moms watch their babies, they know why they got kicked so much inside because they do tend to move around a lot. So this baby's head is nice and round, but that's not always the case. Sometimes you'll notice that they're pointy for the first few days of life, and that's because of how they came out of mom. There's a soft spot right there. You can touch it. It's not dangerous. Sometimes you'll actually feel a pulse there. There's another little soft spot in the back, which most people don't talk about. That closes about 6 weeks. This one closes 9 to 18 months. Babies can see, but they don't see 20/20 like we do. A newborn probably sees about 2200, so they definitely do better with contrast like black and white or bright primary colors like red. Babies sometimes have a little bump under the nipple. That's normal. That's from mama's hormones. If you press on them, sometimes you'll get a little milk out. Don't worry about that. That tends to get better over time. Babies come home from the hospital with a cord. The cord comes off, falls off by itself in about 7 to 14 days. Just try and keep it dry. So fold the diaper underneath it. A newborn little girl, you might see that her labia are swollen. That's totally normal. It gets better. The circumcision, as it heals, will have a little bit of yellow on it, kind of like if you cut the inside of your mouth. That can be normal too. Babies tend to have often cold hands and feet. Sometimes they're blue, not dangerous at all. All babies heal in the first month of life. This baby hasn't started yet. You can use lotion. They'll smell better, they'll look better, but they'll still peel. very common birthmarks or a little red line right there. This baby has a little bit of it. When they have it there, oftentimes they have a little bit on the eyes. Those always go away, but can take a year or two. When they have that, they often have a little red spot in the back. That doesn't always go away, maybe about 50% of the time, but it's always covered by hair. The next time anybody has to worry about it, it'll be his wife when he's much older. People ask about cutting babies' nails. You can file them or you can cut them. Never clip them. Clippers are much more likely to cut the skin. Thank you for tuning in to Trusted Pediatric Advice.
All right. Well, that brings us to our Q&A session, so I'll hand it back over to you, Dr. Fierstein.
Great. Are you going to bring all the doctors so we can see them? Hello, everyone. Thank you all. That was a lot of fun. So there were a bunch of questions that came up. I tried to answer some as we went along, and I kept some for us. So let's send this one to Dr. Visentin. How often should I take my child's temperature?
I'm sorry, the question was how often should you take it?
Yes.
So you really only need to take your temperature if you feel that your baby is sick or you feel that your baby is warm, that they might have a temperature. You don't have to routinely take it unless there was a concern that you thought the baby was sick.
Cool. And speaking of temperature, Dr. Levene, what temperature should we keep the house?
My personal feeling is keep the house what you normally keep it at and just dress the baby slightly warmer than you dress yourselves. Too hot, too cold, not good. It all depends on where you live. I don't heat my house in the winter and my kids just got used to it.
So, swaddling. My baby doesn't like his hands swaddled. What should I do? And also, when do I stop swaddling? Dr. Chalson.
So a lot of babies that were kids that were looking for their hands in the womb are not interested in being swaddled because if their arms are in, they can't get at those fingers. So if your baby is Houdini and tries to keep popping out, you can swaddle the rest of your child while the arms are out and then they have nice access. Just make sure that you're really cutting those nails nicely because otherwise they can really scratch themselves. And in terms of coming out of the swaddle, as you're seeing the development progress and they're doing more tummy time, once you start to see that the baby really is able to roll from belly to back, or when you see that the baby starts to scooch all around within that swaddle or in the bassinet, they really need to be out of the swaddle. A lot of people lately are switching to a Merlin sleep sack, which has all kinds of contraptions that can zipper off and on. It's a little bit weighted, so it supposedly supplies that security that a swaddle would supply. Some people use just a sleep sack, which is not weighted, and then the arms are out, but the baby's legs are able to move and they can roll safely in that. Or just a pajama with a footed onesie is just fine when they come out of the swaddle. No blankets or pillows ever in that crib.
So, Dr. Visentin, there were a lot of questions about breastfeeding, and one of them was really what resources should I look to? And how do I know if I'm doing things right? You had said you could spend an hour talking about breastfeeding, yes. But could you just give us a little bit on, how do I know that my baby's getting enough?
Yes. That is probably the most common question I get, maybe after, why is it hurting? So yeah, how you know that your baby is getting enough is going to depend on a few things. One is going to be the frequency. So if your baby is eating 8 to 12 times in that 24-hour period, if your baby is peeing and pooping enough, that is also one of the ways. If enough things are going in, then enough things are going to be coming out. So if your baby is having frequent wet and dirty diapers, that's how you know that they are eating enough. And then there is a little bit of, you're going to be getting to know your baby. You will start to notice that their suck will change when the baby is nursing. It will be quite strong and vigorous in the beginning, and then it will slow down as the baby starts to fill up. Babies will often be sort of tight and clenched at the beginning of a feed. They'll be putting their hands to their mouth. They'll often with their mouth, stick their tongue out. Those are early signs of hunger. And then you'll notice as the baby is nursing, they tend to relax a little bit. Towards the end of the feeding, The baby, you can move their hands quite easily, even though they're still nursing. We sometimes say that the baby gets a little bit milk drunk, that they tend to relax a little bit more. And then you can sort of relatively easy put the baby down. And so those are some of the ways that you'll know that the baby is eating enough. When you go to the pediatrician, they'll be checking on the baby's weight. And so that's another way. When you go to the office, that's one of the ways that you will also know that if your baby is gaining weight appropriately, that the baby is eating enough.
So with a specific feed, do you time it, or you're just looking more at the baby's cues?
A little bit of both. How long a baby nurses depends on a lot of different things. Depends on how old the baby is. It depends on how fast mom's milk comes out, how vigorously the baby is sucking. So for some moms, the milk starts flowing quite quickly and the baby latches on well and sucks very vigorously and may be done in 10 minutes on each breast. Some other babies are a little bit slower, and the letdown takes a little bit longer. And so those babies may nurse for 20 minutes on side. Both of those are completely normal. And as long as the baby is peeing, pooping, gaining weight, all of those things are completely normal. The other thing I was going to mention was that the size of mom's breasts actually do not have anything to do with how much milk she makes. That is a very common misconception, that people are worried that they have small breasts and that they won't be able to breastfeed. So there are very few medical reasons why a mom would not be able to breastfeed. Breast size is not one of them. The best thing that a mom can do is feed her baby often. The more she feeds the baby, the more milk she will make. And so if in doubt, feed the baby, put the baby to breast. That's the best thing that you can do to make sure that you have enough milk for your baby.
Excellent. And I want to put a plug in for Allied's lactation hotline and our lactation consultants, because I found even with moms who are experienced, it's their second or third baby, sometimes all it takes is just a little tweak here or there, a little suggestion, and all of a sudden things are going much more smoothly, and you're much better off doing that early. Do it in the first week. Don't wait until your nipples are torn apart and you're miserable and that kind of stuff.
And every baby is different. So like you said, even if you've had a baby before and breastfed that baby, your next baby is a different baby. And moms and babies fit together differently. And nursing really should not hurt. Moms will feel pressure, they will feel suction, but it really shouldn't be. One of the most common things I say to moms when I see them for lactation visits is, if you're going like this when you're feeding your baby, that is your body telling you that something is not right. And please reach out and ask for help, and ask for help in the beginning. You should be doing this 8 to 12 times a day. We do not want you, every time it's time for your baby to feed, to be dreading, oh my goodness, because it's going to hurt so bad. So please, if one of the things I could stress is reach out for help early. It is usually easier to correct things early, and much more enjoyable for mom and baby. Babies get more milk when they are latched on well. So it's not just about mom's comfort. If mom is experiencing pain, that typically means the baby is not latched on well, and that baby is not getting as much milk as they can. So it's for mom's benefit and for the baby's benefit for them to be latched on well.
Great, thank you. So Dr. Levene, for those moms who are choosing to formula feed, do you have any suggestions as to what the right formula is, and how do they know how much they should give their baby?
I always recommend that you start with a milk-based formula. It doesn't matter what the brand. It could be Enfamil, it could be Similac, it could be Walmart, it could be Costco brand, any milk-based formula. And most babies in the first few days are going to take very little formula. Remember, if you're breastfeeding, you're only having colostrum. I always say, put an ounce of milk in the bottle. Most babies in the first few days will not even finish that ounce. If the baby finishes the whole bottle, then start adding more. My recommendation is always put in a little bit more than the baby took at the last feeding.
Right, I love that answer, because then you don't have to be in control, the baby's in control.
That's right.
What about organic formula? Do you think that's important?
I personally don't think it's important. I'm not somebody who does organic in my food, so I don't believe in organic for the formula. But if it's something that makes you feel better and more comfortable feeding your baby, go for it. I do not recommend that you order the formula from Germany via Amazon at $40 a bottle. One is it's not FDA approved. We don't know what's in it. Just because it's coming from Germany doesn't make it any better than any other formula that is made in America and is FDA approved.
Right. I love those formulas because the moms ask me questions and it actually says toddler formula on it because they can't get it into the country as an infant formula. But they say, no, it's okay. It's the same. You just use it anyway. And, you know, I'm very lax as well as to which formula and which you choose and what your preferences are. But definitely go for one that actually uses the word infant formula on it. Dr. Chalson, how long can I let my baby cry? And a correlator to that is, how do I get them to sleep through the night?
Those are two big topics. How long you let your baby cry depends on you, your partner, and how old the baby is. So in the beginning, you don't want the baby to cry very long at all. Crying is the only way that they can communicate, I think. And so if they're crying, they are trying to tell you something. Most often in the beginning, it's I'm hungry, I'm wet, I'm dirty, I'm tired, or can you please snuggle me? Which is all they might really want, and that's okay too. As they get older and you get more and more tired, then it's probably reasonable to let them cry and learn to self-soothe, which is an incredibly important life skill. And usually we recommend around the age of 4 months. If they're not sleeping longer stretches by themselves, that's the time where we might start talking to you about sleep training. And how you do that sort of goes from the sublime to the ridiculous. If you're one of my partners in the office, he says, kiss the baby and see them in the morning. And that doesn't work for a lot of people, although there's nothing wrong with it. And a lot of people use a timed method, but there are probably 700 different ways to skin that cat, and you have to find the one that's right for you. You sort of want to make sure the baby is sleeping for more hours and gaining weight beautifully before you really think about trying to ignore them at night. They are telling us in the beginning that they don't have enough calories stored up and they need those feedings, especially if you're nursing, to make sure that that milk supply stays nice and strong. So you don't want to skip feedings in hope that you're going to get a little bit of extra rest. But I promise you, you will some point in your life, maybe when they graduate from college, or maybe not even then. I don't know, Carrie, are you still sleeping? Your kids are grown.
We're sleeping. We're
Okay.
sleeping. And that little baby that I showed you in the thing, he's actually already sleeping through the night. So there is hope. Kevin, we're on the hour mark. Were there any questions that I didn't get to that seem important to you?
Can you hear me? Yeah.
Yes.
Okay, great. There was like 10 questions about when do you start tummy time? There's a lot of questions. So just before you answer that, we're gonna have to follow up with a lot of you. So we'll come up with a Q&A and we'll get those answers out to you because the questions are coming in fast and furious right now. So we'll build a Q&A and send that out post this. But the tummy time question was, when does that start?
I'll take that one. As soon as the cord falls off, put the baby on the tummy. And you'll find at the beginning that they barely lift their head. And then each time you put it, it may be changes day to day. That baby will slowly start to push up and push up and push up. And that's how babies learn to develop their shoulder muscles, because you're putting them on the belly and they're practicing. Would you guys agree?
Excellent. So like Dr. Fierstein, you said, we are up on the hour. I appreciate all of you joining us tonight. Thank you, panel. This was awesome. I hope a lot of people learned some valuable information. And like I said, there are a lot of questions here, so we will put a Q&A out, as well as we'll send a follow-up with this video and the video on newborns and COVID-19, which we did about a couple weeks ago.
Right.
So I thank you. Yep.
I would also say all these questions are totally appropriate for your pediatrician. So do a telehealth visit and ask your actual doctor who has your chart and knows your baby's history, and they can answer these questions for you as well if the baby's born. And if not, you can ask them during your prenatal consult.
That's a great point. And I will just say this, some of these questions are very specific and you should be contacting your pediatrician. We will only be doing a Q&A on the general high-level overview of answers to some of these questions. So like Dr. Fierstein said, please reach out to your pediatrician if you have specific concerns regarding your newborn. All right.
Thank you, everybody for listening, because you guys gave us all these questions and are the reason that we did this. Thank you, panelists. It's been a pleasure, and I will see you at the next Allied meeting. Bye, guys.
Bye.
Bye.